there, my name is Sarah Smith and I will be presenting a narrative speech today. My audience is...
Hi, I'm Jorn.
Hi, I'm Cadence.
All right. Becoming pregnant with identical twins can carry both excitement and anxiousness. But could you ever imagine being told that you may lose your children due to a rare pregnancy complication? Being a mother is one of the most rewarding jobs ever. I've learned to be protective and keep my 3 children out of harm's way at all costs. However, the scariest part about being a parent is when your children's health is in danger, leaving you out of control while having to put faith into your doctors. Although not everyone in the audience has been pregnant or are parents yet, I hope my story can help the audience gain knowledge on the topic itself. In the spring of 2016, at my 32-week ultrasound checkup, my OBGYN, Dr. Jacoby, detected a rare pregnancy condition called placental abruption. By the end of my speech, the audience will gain insight into dealing with what placental abruption is and what it does to one's pregnancy and health. Today, I am here to share my story with you about what placental abruption is, the process of giving birth, and the complications it brought onto my twins, and finally, how it affected me overall. What is placental abruption, you may ask? According to the article Placental Abruption by Marcia Dimes, a placental abruption is a rare condition in which the placenta separates prematurely from the uterine wall. When this happens, the baby can stop receiving oxygen and many health risks may occur to the mother. The article also discusses that 1% of all women go through placental abruption, and those who are pregnant with multiples have a 1 to 2% chance. Symptoms associated with placental abruption consist of vaginal bleeding, abdominal and back discomfort, and a decrease in the fetus's movement. The mother may face life-threatening issues such as shock due to blood loss, blood clotting issues, the possible need for a blood transfusion, and failure of kidneys and other organs. The cause of placental abruption are unknown. However, we have a pretty good idea of what causes this rare condition. Anywhere from taking drugs, having high blood pressure, having more than the average amount of amniotic fluid surrounding your baby, trauma to the belly, or pregnancy with multiples. According to the American Journal of Epidemiology, the standard procedures and tests used to determine if you have a placental abruption are ultrasounds, blood work, urine tests, and a full physical evaluation. The article also discussed that treatment depends on how severe your condition is. It is impossible to reattach the placenta to the uterine wall. Typically, if doctors can get you to stop bleeding, you may be placed on bed rest, but only if you are before 34 weeks pregnant. And in extreme cases, a C-section is required. Now that you have a firm understanding of what placental abruption is, I will share with you my personal experience being diagnosed with this rare condition. The morning of May 10th, 2016, I was diagnosed with placental abruption. I thought I was having Braxton Hicks contractions, which are sporadic contractions that occur during pregnancy, and to which I had regularly. The morning I went to my high-risk ultrasound appointment, I had a brief ultrasound and was quickly taken to labor and delivery to be assessed by my OBGYN, Dr. Jacoby. After reviewing my test, she looked over the monitors and said to me, "We have to have an emergency C-section right now. You and your twins are in bad condition." I lost it. My entire body went into shock. I was sweating profusely, heavily shaking, dry heaving, and crying out for help, all while severely bleeding on the hospital bed. I was terrified for my babies and I. I was given an epidural along with injectable anesthetics. The only thing that kept me from not having to go under while under delivery was the help from my OBGYN. She was my biggest supporter and guided me through my delivery second by second. After finally being discharged from the hospital, I was relieved. But little did I know, this was only the beginning of many years of hardship for my family. Going through an emergency C-section because of a placental abruption has affected not only my children's health and their lives, but mine as well. Being diagnosed with this rare condition has caused an array of difficult hardships. Because my twins were born premature at 32 weeks, their cognitive and emotional development has been delayed quite significantly. However, after 4 years of intensive speech therapy and individual educational classes, they are finally catching up to their age group in all aspects. Placental abruption affected me in ways I still deal with today. I suffer from horrible nightmares and high anxiety. As a mother, watching your children die numerous times through dreaming could be quite challenging. I do not get a lot of sleep because of it, and I have become an anxious person since the birth of my twins. Being diagnosed with a rare pregnancy condition has left me with many emotions, but both of my sons survived, and we are all in good health. Today, I have shared with you all my story about being diagnosed with placental abruption, the process of the birth of my twins, and how it affected us overall. Even though my pregnancy was not what most people would consider an ideal pregnancy, this terrifying situation is something I will always treasure. I have been able to overcome a plethora of fears due to me experiencing such a traumatic pregnancy. Having a placental abruption is something that will have an impact on me for the rest of my life. Anytime I have been to the hospital with my sons, I will forever be thankful that all three of us are alive. I strongly suggest if you ever do meet someone who has placental abruption, offer your support. They will be very, very thankful. Thank you.